Okay, let's get started. Hi, everyone. We're going to be discussing today how Tampa General Hospital builds a safe environment for nurses. My name is Iman Abuzaid. I'm an MD by background. I'm the CEO and co-founder of Incredible Health, which is the fastest growing career marketplace for healthcare workers. Hospitals and health systems use our software to hire nurses in permanent roles in 20 days or less. We flip the script so hospitals and health systems can apply to nurses instead of the other way around. Joining us today is Annmarie Chavarria. She is the SVP and CNO at Tampa General Hospital. So Tampa General Hospital is magnet designated and it's ranked as the #1 hospital in Tampa Bay by US News and World Report. It's also ranked among the top 50 hospitals in the nation in 7 specialties. Annmarie is a Philadelphia native, and she has spent more than 15 years as a nursing leader and holds a doctorate of nursing practice from LaSalle University in Philadelphia. Prior to that, Annmarie was chief nursing officer at Abington Jefferson Health, which is part of the Jefferson Health system in Philadelphia. Her favorite part of being a nurse is watching other people to grow. So thank you again for being with us today, Annmarie.
Oh, I'm really excited to be here. Good afternoon or good morning to everyone. Not sure what time it is wherever you are, but excited to have this conversation today.
Awesome. So this is designed to be an interactive discussion. For those of you in the audience, please feel free to ask questions in the chat and we'll answer them as we go along. And we also have dedicated time at the end to answer questions as well. And then, this webinar will be recorded as well. And a member of our team will be in touch with the recording after the webinar is over as well. Just want to take care of some housekeeping items before we dive in. Okay, so today in our agenda, we're going to be covering the state of the nurse labor market and what's happening today. We're going to be covering nurse retention, nurse training, how to build a safe environment for nurses, nurse hiring, and then how Incredible Health can help. And then we'll also have dedicated time at the end for Q&A. So we have a pretty full agenda today. And just, I encourage everyone to participate. Feel free to ask as many questions as you like. And Annmarie is here to share all her tactics or secrets or strategies for solving some of these tough problems. All right, let's start with a brief market overview. So let's set the stage. We're all sort of in the same boat together in terms of what's going on in the market. So at a high level, our demand for healthcare as a country continues to increase because our population is aging and our supply of workers has not kept up with that demand. Healthcare workers, I'm referring to nurses, to doctors, to all the allied health professions. We simply do not have enough clinicians in this country to support the Americans that need the care. We are, as of 2018, healthcare became the #1 employment sector in the country, and 1 in 8 Americans works in healthcare. Some of the problems that we are all tackling is we are on track to be 1.1 million nurses short by the end of next year. And we're also seeing sort of unprecedented numbers of nursing turnover. Right now, nursing turnover is at 18.7% nationally. It has actually gone up by 2% in the last couple of years, which is a big increase when you look at a national number like this. We're also seeing labor get more expensive. So labor as a percentage of revenue continues to increase. And that's not just the premium or temporary labor, but even permanent nurse labor continues to increase as wages increase, as sort of the additional incentives that nurses need to attract and retain nurses continues to increase too. And then also we're seeing an average days to fill of 89 days to fill a specialized permanent nursing role in the US today. Annmarie, these numbers are probably not foreign to you. You're tackling some of these similar challenges at your health system too. All right, so I wanted to just set the stage also just by sharing some of our latest data from the Incredible Health Marketplace in terms of why it is that nurses are changing jobs. What are they looking for when they're doing their job search, or why are they considering leaving their current employer? These are the top reasons, and they're ranked in order of how often they're selected when a nurse is creating a profile on Incredible Health. And the data comes from about 10% of US nurses. So 400,000 nurses are use our platform and are signed up for Incredible Health. So by far the #1 reason is they're looking to advance their careers. Okay, so that can mean they're trying to specialize, they're trying to they're trying to specialize further, they're trying to cross-train, they're trying to move into management. They could be a new graduate nurse who's trying to join another unit. It's a whole variety of things, but something to do with skill growth and trying to advance their careers. The second most common reason is they're looking for a better schedule that works better for their life. The third most common is something to do with geography. They're relocating. So for example, relocating to beautiful Tampa from other parts of the country, or they are trying to reduce their commute times if they're already in the area. And then the last is they're looking for more pay. We work with 600 hospitals and health systems across the country. Many nursing and HR executives are very focused on the compensation piece, which is an important piece, but increasingly more and more leaders that are focused on the career advancement as well as the flexible scheduling are now able to hire more and retain more too. All right, so I will take the slides down for a moment. And so Annmarie, would love to hear just how the pandemic impacted your hospital over the last couple of years.
So Tampa, just like every other hospital, really got the pandemic hit us hard. I will say what was different about it, it hit different parts of the country at different times, right? So I did, originally I was lived in Philadelphia, and that's where I worked. And so at the beginning of the pandemic, that's actually where I was. And so New York, that Philadelphia, New Jersey area got hit the very beginning when it was super frightening because we didn't know what to do. Florida, actually here at Tampa General, we got hit about a year later with the surges of Delta and Omicron and all of those. So the good news about that, if there's any good news about a pandemic, is that we knew how to treat it, right? We knew how to protect ourselves. We knew we had vaccines. We knew how to treat patients. So there was a lot less death. But the hard part about it was at the same time that we were still extremely busy. So that volume came on top of our usual volume. None of our hospital volume was decreased in any way. And it was also the beginning of that great resignation of nurses, where nurses started to leave all of their permanent positions. A lot of them took the travel nurse positions because they were making a lot of money doing that. And so there was a time when our workforce became very unstable. So we had a lot of things going on at once, right? Yeah. A high volume. Our nursing workforce was, in transition and becoming a little unstable. And it was a really difficult time. I would say just in the last several months are we actually starting to feel like we're recovering from that.
Okay, got it. So not probably pretty common experience of many of the attendees on this call as well. So, what do you, from your perspective, what do you see as some of the greatest challenges that nurses are facing today?
I think stress and burnout, everybody says that stress and burnout is the greatest challenge our nurses have today, but really we have to talk about more what is causing that stress and burnout, right? What is the reason for that? And so if we don't have enough people to do the jobs, right? If our workforce is depleted, we have a lot of competing priorities. And so we really have to get to the underlying reasons that our nurses are feeling that kind of stress and burnout and fix those things first, like the foundational things. And then in addition to that, this is a stressful job on a good day with everything perfect, right? Because this is just where we have people's lives in our hands. So we do need some specific tactics on how to teach people how to take care of themselves, concentrate on wellness, relieve stress. But we really need to make their jobs as easy as possible. And I don't mean easy, but, get some of the roadblocks out of the way, the pebbles out of their shoes, give them processes that work so that they don't have as much stress.
Got it. Okay. You mentioned also, train, like the lack of resources, right? So not enough staff, but there's also like a training challenge going on as well. You mind just sharing a little bit more about that?
Yeah, so I think everybody who's on here probably is experiencing the same thing. So everybody had to shift how we did training during the time through COVID. So not only did the schools have to shift, and they really were, a lot of them not taking care of patients or not taking care of as many patients hand-on. They were doing a lot of simulation training, a lot of computer learning. And then we were doing the same thing as hospitals. Once the nurses came out, we weren't able to have them in big rooms and do normal classes the way we did, and we were teaching them online. And so the nurses now, they're just less prepared, right? They had less experience doing some of the things that nurses previously were able to get in training and education. So that's really what we're trying to recover from now, come up with new ways, not only to train the nurses that are coming in, but to retrain some of the nurses that have been here for a couple of years, right? And give them some of that, some of those pieces that they might have been missing, so that they have that critical thinking and the knowledge and some support. I think in addition to that, not only do we have to come up with creative ways to teach and educate them, we also have to find, we're lacking experienced nurses now,
Yep.
right? So we have this large number of new nurses, which is great. At least we are, at least in this area, able to fill a lot of our open positions. But now we just have this really large number of new nurses that don't have the same skill set that experienced nurses would have, just from, you know, from years and years of doing these things. So we really have to take our experienced nurses and figure out how to spread them out a little bit,
Yeah.
so that they can share their knowledge and really work with some of the newer nurses. And so we have to be super creative about how we do that. And I know lots of hospitals are trying to do that in different ways.
Got it. Do you want to share a couple of ways that you're sort of sharing the experience, or tackling the experience gap at your hospital?
One of the ways, I mean, this is the thing we're working on most immediately right now, which I'm really excited about. And it goes back to the topic of how do we use technology, right? It's 2022, right? And so how do we use technology to our advantage to really help tackle some of these issues? So we're implementing something called the virtual nurse in 2 of our critical care units as a pilot. And so we'll have a camera in every room, and the cameras that we're getting are actually amazing. They can zoom in all the way down to like your pupil. So there's lots of really high technology cameras that people can use for these things. But that's the cameras that we're using. We'll put them in these 2 critical care units as this pilot, and we have one really experienced critical care nurse who will oversee a lot of newer nurses in our critical care on these 2 critical care floors. So they'll do things like double check their medications, answer their questions, act as a resource, help them with their admissions in case they're, you know, something's new to them. There's like a long list of things that they'll do, and they don't even have to be on the unit, right? They actually remote. They're somewhere else in our hospital is how we have it set up, but they really are not on the unit, this resource. Another thing that we're doing, which I think is really exciting, is we expanded our rapid response team. So most hospitals have that, which are usually really experienced critical care nurses that go out when patients are declining. So we've doubled the amount of those nurses that we have on. And then we have a lot of technology in the background trying to support when patients are declining. And these nurses go with those nurses. If they see a decline in the patient by one of the, either one of our tiles or our sepsis tile, we have a bunch of technology in the background that's running, like our Muse scores and things like that. Then the rapid response nurse will go and work with the nurse who's taking care of that patient to help them. So that's an additional resource that we're trying to put out there for nurses who may not even see those things happening yet.
That's great. The virtual nursing pilot that you described sounds like what anesthesiologists did, you know, a few years ago, right? Where one senior anesthesiologist is covering multiple ORs. That's awesome. So look, there's been a big focus on retention. Okay, like it's probably one of the top concerns any CNO has at every health system. Sort of, would you be able to share some of your strategy around what you're doing to retain nurses at Tampa General?
Yeah, so there's like obviously a long list, right? We have a whole team working on this, but I will tell you the number one thing, and I believe this with all of my heart, is really creating the culture where nurses want to be in that environment, right? So we really spend a lot of time focusing on how we take care of each other, how we take care of our teams, what we can offer them, but not just what we can offer them financially, just really how we're here to support them with kindness, transparency. We do hold people accountable, which people are usually grateful for that, right? Because they want everyone to be at a certain level, especially if you're a professional. But that's really the number one thing we're trying to do, is really have a culture where nurses want to work. And I will say, I think we're being pretty successful with it. We've had nurses leave for more money to go other places. And then a lot of them, we have 300 nurses who have returned back
Great.
to Tampa General in the last several months. So I think culture goes a long way, right? People want to work where they know that people care about them and where they care about each other. So that's one of the retention. Of course, we have lots of other things that we're doing, right? We have increased our pay scale twice.
Yep.
We've increased our benefits, taken caps off of tuition. We have a lot of wellness programs for our teams. We have a lot of professional development opportunities for the teams here. So we actually have a whole, it's called the People Development Institute, where we work with University of South Florida and University of Tampa. And we have classes that people can take free if they work here towards professional development activities. So lots of things to really keep people engaged and help them grow professionally. But I will say that I honestly believe the culture is the most important thing.
Got it. Okay. Curious, how do you sort of implement the culture that you want?
Yeah. Well, it starts with the leaders,
Okay.
right? So you have to have the right leadership team, because lots of places, and I've worked other places, right? They all say they care about the team, but actually, truly, like being out there, I'll use myself as an example. Like I will shadow on the floors for several hours. I did it not this Monday, but the Monday before in one of our critical care units. Our CEO does the same thing. He was in the neuro unit the week before I did. So really taking the time to see how the teams work with them, understand what their needs are, and then as leaders, helping them work through those things and get the things that they need. But you do have to have the right leadership team, right? Everybody has to buy into that. That's the most important thing. If we take care of our team, then our team can take care of our patients. So really building that at the foundation of the leadership team and making sure everybody has that same mindset.
Awesome. So on we spoke earlier about how career advancement and looking to grow their careers and their skills is it's the number one thing that nurses are looking for. You've touched on it a little bit about what you're doing for professional development, but we'd love to go deeper in that area. Can you just walk through sort of what is your career advancement strategy for nurses and what you've put into place to help with nursing professional development?
Yeah, so let me see if I can kind of keep that thought organized, because there's so many things that we try to do here. I will say in our performance appraisal, so for every nurse, for every team member that works here, but definitely for nurses, we have something called career mapping built right in there. So we take what the particular nurse wants to do for themselves, what they see as their career goals, and then we sort of map it out and help them find the particular classes or committees that might fit into that so that they can progress in their career. We also have, obviously, like a lot of magnet hospitals, we have a really strong clinical ladder program where nurses can, if they participate in certain activities or they educate or they present, that they can take steps on the ladder that way. The other thing I would say, because this is a big academic medical center, right? We do have the advantage that there's a lot of specialties that nurses can go into. So people want to come and work here because they know they can work in the burn center or the transplant center or cardiac open heart surgeries. There's just so many opportunities. And then when we put them into those areas, all of their training and competencies are based on those specialties. And people have the opportunity to move around from one specialty to another. So I think people really do value that they can have some professional development. I think for hospitals that maybe don't have all of that, really helping people specific career maps or succession plans, really getting the personnel touched, know what's important to that nurse, because every nurse has a different thought about what they want to do professionally. And then as the leader, really trying to help each person get to where they are, whether it's your own internal resources that you offer them, or you help them get set up with outside resources in schools and things like that.
Got it. Okay, so the career mapping that you described, that's something that's actually documented for every nurse?
Yes.
That's great. That's great. And then you mentioned some collaborations with your local schools. So how are you working with local universities and schools?
So USF, University of South Florida, is our partner at TGH. So I work most closely with them. I actually have an appointment on one of their boards, and then as an associate professor there. So I work with them on a lot of initiatives. But we do work with our other schools, but I'll talk a little bit about University of South Florida, and then I can talk about some of the other ones. What we've built most recently with them is some Preceptor to hire programs. So they bring their, when their students come here for their senior year, we specifically have them apply to certain units, and then we train them in a very specific way on that unit. And when they're finished, they like 90% of them got a job on the unit where they worked. Some of them didn't want to, or some of them, I don't know what happened with the other few, but most of them took a job on those floors. We are now going to expand that to some of our other nursing schools that come here, but we, you know, we built it with our partner to make sure that it worked, and now we'll build that out for some of the other schools. Some of the other things that we're doing is really working with USF on having some of our master's prepared nurses become adjunct faculty there, so that they can ultimately increase the number of nursing students they can take into their programs. So hopefully most people on the call today know that we don't really have enough instructors in the nursing schools, which is why some nursing schools, many of them have to turn nursing students away. So if we can support some of our universities with our nurses who are working clinically, they can expand the people that apply and get accepted into nursing school, and ultimately that gives us more nurses. So we're working with USF on that, and then we will obviously expand that out to some of the other schools. And then we're building an externship program, which would be open to nursing students across all of the schools that we work with right now. So there's lots of opportunities to work with the nursing schools. I mean, we're fortunate that we have a lot in our area that are big nursing schools. Yeah. I know not everybody has that luxury.
Yeah, absolutely. One question that came through, it touches on a topic you mentioned earlier, and that's, you sort of briefly mentioned wellness programs that help continue to support your culture. Mm-hmm. Do you have what are your top tips or suggestions for nursing leaders that want to implement a wellness program?
So I obviously could never take credit for implementing that. That's really done at the organizational level. Yeah. So I would say what we have done specifically in nursing, and not just here, but lots of places have done this, is really try to figure out ways to take that wellness right down to the unit level. Because I think, and the team member level, because what happens is if you have a bunch of programs, people don't generally want to spend a whole lot of time outside of work doing things that are associated with work. Although I will say more and more people are doing it now, which makes me really excited. We put a program out just like 2 weeks ago that was offering counseling service, like immediate appointments for counseling service. And we had almost 300 people call and sign up for that, where in the past, I don't know that healthcare providers would have been so open to do that, right? We would have, nurses and physicians, we would have just kind of maybe sucked it up, or I don't know what else to say. Like we may not have reached out for that, but I think because of all that has happened over the last couple of years, I think people are really much more open to those things. So I would suggest really whatever your own hospital has, really using that and trying to get that out to your teams. A lot of times teams don't even know what's really offered by their hospital, depending on the size. The other thing I would say is taking some things right to the teams. So a lot of things around like positivity and gratitude that really help people with resilience and burnout. Those things can just be done on the unit level in their everyday work, right? Just build it into the meetings you already have, into the conversations, onto the boards that you already have on your units, and really just encourage your teams to participate in things like that.
Got it. Okay, so I wanted to touch briefly on the topic of compensation. You mentioned briefly earlier around there's already been some compensation resets that have happened a couple times already, or improvements that have happened already, as well as other perks and benefits. Can you just share a little bit about how the compensation evaluation process works at Tampa General?
Sure. So previously, we used to wait for the market adjust. Like there's some survey that gets sent out by all hospitals. You get it once a year. It's a really lag measure. By the time you get it, it's like months and months past. And so we realized that data was not really helping us stay ahead of the market. So now we use something called pay factors, and it really gives us updated market data like every couple of months. So we can see right where we are compared to other hospitals, not only locally, but across the nation in real time. And then we're able to adjust and pivot much quicker with our salaries. And we really have taken the approach that we're looking at that all of the time and not waiting to fall behind.
All right. So the next topic we want to go through is just nurse resilience. So, that we talk in a very high level, like, hey, nurses need to be more resilient. Okay, but that actually requires it's very specific tactics and approaches to make sure it happens. Would you be able to just share in detail, in a little more detail, what you do to promote and to encourage nurse resilience for your team?
Yeah, somebody had sent me we actually have one of our shared governance councils is called Healthy Work Environment. And that's where, and it's one of our largest councils for a good reason, right? Lots of nurses like to participate in that council. So I had them send me a list. I'm like, tell me all the things that we've been working on lately, right? About nurse resilience. And so what they sent me was they have done, hold on, did I get you the list? Sorry. So we started sports rounds, which is great here. We didn't have that here before, but that's a nice opportunity for nurses to participate and able to talk about things that have happened that really impacted them when they were taking care of patients. We started a community resilience model training. So that's really like, it's an app that they use after they get some training that helps them anytime that they're feeling stressed, kind of decompress. We set up Zen zones and an entire lounge that has like relaxation chairs and those kind of things. So I know lots of places have all of that, but I will tell you, really, when it comes to resilience and burnout, I want to focus on it's really making the job as easy as possible for the nurse and trying to get the barriers out of the way. So really taking the time to focus on things that they bring forward as issues and barriers. And so we've come up with some processes around that. We do a start of shift safety huddle now that is very standardized. And they use an app to report in things that are either barriers or safety concerns. And then we have tiered huddles where we raise that up, and many times we can handle it right in the moment that day. If not, we are able to put a team together and see how widespread these barriers are and really get those things fixed for the teams so that they don't have all of that additional stress on top of the fact that their job is already hard. So I think things like that are really what we should be focused on, trying to streamline their work and make their processes as easy as possible. And that really would help with resilience and burnout.
Yeah, absolutely. And you also have nurse mentoring set up as well, is that right?
We do. We have a mentoring program. We have where the nurses, they all go, well, all of our new nurses who have less than a year experience go through a residency program. Mm-hmm. And then after they graduate the residency program, they can go through a mentoring program. It's optional. We don't obviously make people do that, but we do have a formal mentoring program set up for them.
Got it. Okay, so let's go a little bit deeper into the topic of training nurses. You mentioned earlier around you have these schools around you. You're able to hire new graduate nurses, which is great. Just curious how many new nurses are joining, per month.
This is going to sound crazy, but so we hire anywhere from 90 to 150 nurses a month. That's been over the last several months. There's a lot of reasons for that. One, we obviously had a lot of vacancies, but two, we're also expanding and changing our staffing models, which required us building up an internal float pool. So lots of reasons that made us, we had additional positions to fill as we were growing. So we bring in a lot of nurses every month. I think that'll start to slow down over time. And again, all of the new nurses who come in, if they have less than a year experience, they go through a residency program. So we have a lot of people going through that residency program as well.
So how often is this residency program run per year?
So we have 5 cohorts. So they usually start every other month. And there's 60 or 70 nurses in each cohort usually. Okay.
And then what's in the residency program? Like what's the content or?
So we use the ANCC, the Vizient, it's the best practice model, I guess, for the residency program. Of course, we, make it our own and add a lot of things in there. But that it's once a month, they have a seminar where they go through important topics for new nurses as they're learning how to practice and become professionals. We did add a lot in there over the last year and a half about stress, right? Stress reduction, how to handle difficult situations, communication. We added more about workplace violence and how to and health and wellness, how to take care of themselves. But other than the things we've added, it's the usual topics that that Vizient program has.
Got it. Okay. We'll answer a question that came in from the audience. This came from Lisa. She was curious about what program you use for your annual performance evaluations that has career mapping built into it too.
It's PeopleSoft.
Okay. Got it. All right. Well, so let's dive into the topic of creating a safe working environment for nurses. You know, you mentioned technology being used in nurse training. Like, how are you using, you know, technology to support your nurses?
So there's a couple ways. I'll talk about just making their workflow a little easier is one path, and then there's like a safety path, right?
Yep.
What are we doing to make it a little bit safer? So for the workflow, we have almost all of our devices are now integrated. So if you do your vital signs, it goes right into your medical record. If you are on a cardiac monitor, everything goes right into the medical record. We are about to buy pumps and everything will go into the medical record. So really just trying to alleviate some of the extra work that nurses have to do around documentation. It's really about device integration. Some of the more exciting things that we're doing, some of the newer concepts is really, we work with GE and we have tiles that are built to pull out very specific information from all different pieces of the medical record. So I'll use one for an example. I'll talk about our sepsis tile. So the sepsis tile is built so that it pulls out, not only if you're missing something in the sepsis bundle, it will alert. And then we have a nurse who's sitting right in front of there, kind of works with the bedside nurse to make sure that that piece gets handled. It also pulls out all different pieces of data from the medical record if the patient is of concern for going into sepsis. And then we deploy a critical care nurse to check that patient and see if it is truly, if they're truly going into sepsis or if it's something else. And there's several, I'm sorry, my phone keeps going off. So there's several things that that tile keeps, it alerts people to issues that you wouldn't be able to see because it's pulling from so many different pieces of the medical record that you as a nurse would have to hunt and pack maybe to put all those pieces together. And it really gives us warnings, right, about patients who would be declining or have some kind of health issue. And so when I talked about our rapid response team expanding, one of those rapid response nurses is sitting in front of those screens and looking at that particular tile and a couple other things to see if we have any patients that we should be watching out for. A lot of times it'll be a newer nurse that didn't pick up on something, and then they're able to go to that floor and teach that nurse, you know, here's what we saw, and now tell me about your patient. And then in the moment they're teaching, and that really helps. The technology supports the safety, but it also helps us know what we have to teach our team members as they're taking care of these patients.
Right. So despite having all this awesome technology, you know, mistakes still happen sometimes, right? So curious, how do you handle it when there is a human that makes a mistake?
Yeah. So we've been on the same journey that I hope most hospitals are on, really, to like a fair and just culture and how we handle things. Mm-hmm. We've been working on that for 2 years, and we really, every year we have a big symposium where we talk to all of our team members about safety, how we need them to speak up, why that's important. And we've concentrated on 2 years on creating that environment of psychological safety. So of course our reporting has gone way up. And we really focus, once they do report errors or we find errors, we really focus on the systems and the processes that it's never a person, right? It almost never. It's almost never a person. It's always something that wasn't right in the system, or we didn't have a great process, or the process broke, right? And so how do we really get to the root cause of those things and then fix it so it doesn't happen again? And now we're trying to be even more proactive and try to use a little bit of artificial intelligence and things like that to try to look out for things that haven't even happened yet and really be proactive.
Got it. Okay. Great. So let's talk about the topic of nurse hiring. So there's been a lot of nurse hiring activity happening at Tampa General. Curious, like, you know, maybe you can give us an overview of what is your hiring strategy at Tampa General.
Yeah. So we've spent a lot of time working on this over the last year, but we have a great marketing department, and obviously people relocate here to Tampa. So that's something that we have in our favor. So our strategy is via social media and all other marketing techniques out across the nation to try to recruit nurses here. So I would say, I don't know the exact number, but I would say probably 25% of our nurses come from somewhere that is not this local area, maybe more. So our marketing team is really heavily engaged in that. In addition to that, we do have large hiring events, and there's always a virtual aspect of that. So when we have our large hiring events, they usually do it at the stadium, like we do it big. And they have things that are available for people to come in and get all kinds of information about the different opportunities here. And then we have virtual options. So if you are from another state, obviously you could do an interview. We have people set up to do the virtual interviews. That's really our tactic. We haven't done anything else. We go to all the local schools as well and talk to our students when there's either juniors or seniors or both, especially our local schools, to talk about the jobs here and what kind of things we have to offer. Those are our biggest tactics, I would say, around hiring.
Got it. Okay. And you also mentioned, hiring internationally as well. You're one of the few. Increasingly, there's more and more health systems that are hiring internationally. Sort of, how do you think about that strategy? How are you implementing it?
So we work with 2 different companies to hire international nurses. It's not as easy as it was at one time.
Yeah.
And I'll say, just because I think that the entire country is trying to do the same thing. So we have hired 12 international nurses, and they are wonderful. And the company we work with is really great, both of them. And we have about 30 more that are in the pipeline. It takes 9 months to a year for this process to go through. So you might find a nurse, but by the time we get all the paperwork done and everything that they have to go through, it takes about 9 months to a year for them to come. Unless they're from Canada, then it's a little bit faster. So that process is more of a long-term strategy. And they do stay here longer, which is great. They sign a contract to stay here for a few years and work with us. Those companies have really done a great job, I will say. They do a lot of training for those nurses before they come to us. So they have all of these review courses that they do and simulations and practice. So they come pretty well prepared. And we've had great success with the ones who have come so far.
Okay, awesome. And then, part of hiring, we see in our data that some of the teams that are most successful at hiring actually have very strong operational processes internally for hiring, and they're able to get talent through their processes very quickly. So what are the things that your teams implemented to just improve the operational excellence of nurse hiring?
So that's a good one. We have spent a lot of time working on that over the last several months too. So we have a system, it's called Taleo. I'm sure every hospital has a different system, but we have service level agreements. So basically we track every step of the process from the time an application goes in. How long does it take until somebody routes it to a manager? How long does it take for the manager to acknowledge it and then set up an interview? So each one of those steps is sort of tracked. And then we see where we're struggling and focus on the areas where we're struggling. At one point, we realized we didn't have enough recruiters to get all of the applications out. So we had to increase the number of recruiters we had. So I guess just having visibility of the data and where our applicants are in the process has been the key to being able to do better with that.
That's great. And you have, when you mentioned service level agreements, do you mean between the nursing managers or hiring managers and HR?
Yes. Yep.
Okay.
So we all agree to what the time frame is going to be for like each step, and then we hold ourselves to it. Got it.
That's great. And you're holding your hiring managers to that.
Yes.
Yeah. Awesome. All right, great. So next, just wanted to share a little bit more about the Incredible Health Platform. A lot of what you discussed, Annmarie, around just supporting healthcare workers, making their lives better, is pretty aligned, honestly, with our vision and our mission. Our vision is to help healthcare professionals live better lives, and the mission is to help them find and do their best work. and just love all the insights that you shared. We'll do a very quick overview of what Incredible Health is, and then the rest of the time we'll spend on Q&A. And there are actually quite a few questions that have been submitted, so we'll probably go to the top of the hour with the Q&A. All right, so Incredible Health, it's a marketplace technology, and hospitals and health systems, they use our custom matching technology to hire high quality permanent nurses in less than 20 days, instead of it taking the 80 or 90 days to fill. We work with actually now over 600 hospitals and health systems across the country. We work with very big health systems like HCA Healthcare and Kaiser Permanente. We work with many academic medical centers too, like Johns Hopkins and Stanford and Cedars-Sinai and Northwestern and others, and lots of community hospitals as well. At this point, we've worked with magnet and non-magnet. We've worked with union, non-union, every iteration of hospital we've worked with. We support both the hospitals and the nurses in a few different ways. First, the employers apply to the talent instead of the other way around. Nurses love that. Great, they create a profile, they sit back and relax, they hear from different employers, the nurse gets to choose which interviews to accept or decline. We are often described by nurses as the best job search experience of their career. Second, we've built proprietary screening algorithms where we're able to automatically screen the talent. And then we've also built custom matching algorithms. So it's a highly personalized experience for both sides. So let's say a nurse recruiter at Tampa General is using our platform and they log in. They don't really want to see 276 nurses. They need to see, 11 nurses that are the right fit for the roles that recruiter is looking for at that time. And that matches the nurse's preferences too. And then finally, data analytics. A two-sided marketplace does churn out an enormous amount of data. And so we're able to share very customized analytics reports with every single team that we work with. It helps them identify bottlenecks. It helps them identify speed issues and also celebrate successes too. And then most importantly, nursing and HR leaders love our analytics reports because it shows them what the competition is doing in an anonymized way, of course. So that we're able to compare across the country and locally as well. We also offer a whole range of free tools and nurses and services to nurses. That's honestly the main way we attract nurses to our platform. We offer free continuing education to every single nurse in the country, accredited in all 50 states. We have free salary estimators with real-time salary data. Every nurse gets access to a talent advocate or a career coach. We also have an exclusive community of nurses built into our apps where they can ask each other. It's like a Q&A or an advice platform, and lots of other career resources too. And so these free tools and services attract tens of thousands of nurses to the platform every single month, and a portion of those using the hiring marketplace too. I did mention earlier just the importance of speed and operational excellence. Annmarie shared her tactics of, for example, a very common one is establishing the service level agreements between nursing and HR. The data from our platform shows that 68% of nurses accept the very first offer they receive, and 61% accept the very first offer they receive, even if the second or third offer has higher compensation. So there is a need for speed, and getting talent through a hiring process is really one of the most effective things you can do, and it drives an enormous competitive advantage in your market too. This is the kind of data we replicate for the teams we work with. So with conventional hiring, it takes, for this team, and it's a team in LA, it took them 66 days. With Incredible Health, they were able to get their days to fill down to 19 days. And these are the different steps of the hiring process. Where we have the biggest impact is on time to source. So for this team, we were able to reduce that from 44 days down to 3 days. We were able to reduce days later in the process too with things like automatic interview scheduling, but the biggest impact is on time to source. We also, there's also very strong ROI here, because ultimately we're trying to reduce your cost per hire, as well as remove temporary labor or travel nurse costs from the hospital or health system. Finally, we have higher retention. We measure retention across the country. And so when nurses are hired through Incredible Health, the retention rate is 15% higher than the baseline. And that's primarily because the nurse was able to take advantage of the matching algorithms and really consider multiple opportunities before selecting one. So it's a very well thought out job search. And then this is a true collaboration. This happens to be a slide from the Stanford team, who we've been working with for years. We are really, this is a true collaboration. It's a true partnership. It takes both parties. We partner usually with the in-house talent acquisition team and the nursing leaders. And Incredible Health might be doing the heavy lifting in the first 4 steps of the process. So sourcing, screening, confirming they're actively looking and getting that first phone screen automatically scheduled with the recruiters. And then at that point, the in-house talent acquisition team is taking the nurse through their normal hiring processes, including completing that phone screen, getting hiring manager interviews scheduled, getting offers out, and getting them accepted. So this is a true collaboration, a true partnership. And this is a new model in talent acquisition. We talk a lot about nurses and doctors needing to operate at the top of their license and the top of their skill set. And we do all kinds of work to make sure that happens. But even recruiters need to operate at the top of their skill set too. And the top of the recruiter skill set is speaking to candidates, building relationships with candidates, and building relationships with hiring managers. So administrative work like sourcing, for example, can be automated with technology these days. All right, so I'll pause there. If you're interested in finding out more about Incredible Health, please feel free to visit our website, incrediblehealth.com. Danny also shared our request to demo where you can book a time with our team as well. Okay, so there's quite a bit of Q&A, and we'll try to get through as many of the questions as we can in the remaining time that we have. If there are additional questions, even after the webinar, please feel free to email us at questions@incrediblehealth.com, and we'll get you the answer. We'll contact Annmarie if needed, if there's a specific question for Annmarie as well. Okay, so this is a really specific question, Annmarie. This comes from Wendy. She's the MPD at Advent Health, and she's very interested in hearing more about your dedicated lift team to help reduce HAPIs.
How did I forget to talk about that? Yeah. So yes, I'd be happy to share anything you would like to know about that. If you have your email on here, I can send it to you. But we do have a really fabulous lift team that anytime we have a patient that is hard to get out of bed or, is bariatric or any reason that the nurses feel like they might struggle to get the patient safely out of bed, we have a well-trained lift team that comes. They're here 24 hours a day, 7 days a week. They help all the nurses understand how to use the special equipment we have. We have lifts in some of the rooms, but if we don't, then we bring the equipment to the room. And that is a great resource. Nurses who come here who've worked other places always talk about the difference that makes in their workflow. And obviously we've seen a tremendous amount of a decrease in nurses being injured at work. So it pays for itself for sure.
That's awesome. All right, question from Janice. Annmarie, you worked in different health systems. You worked at Jefferson Health, which is a very large health system, and then now you're at Tampa General, which is an academic center, and it's a single location. So, do you think working through workforce challenges is different at a smaller community hospital versus or academic center versus a big health system? Sort of like, what do you see as some of the differences?
So I will say it's different, but I don't think it's any easier in a one hospital system. I thought it would be, but I didn't really find it easier. I think the whole thing works if you have processes in place and you track those processes. So it doesn't matter if you're 1,000 beds, if you're 14 hospitals, or you're one small hospital. If you don't have good processes around hiring and who does what, and then keeping track of it, I think that's really the key to it. And then obviously you need enough people to do those things, depending on the size of the institution. But really it's the processes. If you have good processes, it'll work anywhere. Got it. Okay.
There's a question from Corey. I think Corey was a former employee at Tampa General. He mentioned having some challenges around the staff being fragmented or siloed, but obviously this was years ago. This was like over 20 years ago. Curious about what you've done recently to just improve the culture so departments and leadership are more connected and interacting more with each other.
Yeah, I would say I spent my last 2 years trying to standardize practice across the hospital. Corey is right. When I first arrived here, I could feel the culture from before where individual areas and units did function in silos. So our CEO really built up our leadership team, myself, the CMO, the CQO, everybody's relatively new, even the chief people and talent officer, everybody is new. And our mantra was to build this as one team. And so we've really been trying to get people out of silos, making sure we have standard practice across our hospital is having standard communication. So that is, he's right. We did function like that for a long time, but and it's not perfect yet, right? But we are definitely out of our silos. Even in particular, like our nurse leaders, if we're going to lead something that has to go across our entire nursing department. So if we're working on, I'll just use a simple example like falls, because every nursing department's always working on falls. We have, each nurse leader doesn't work in their individual departments. We have one nurse leader take that and make sure that we're doing it in a standardized way and own that outcome across their entire department. So we can be sure we're all doing the same thing.
Got it. Okay. This was a question from Benjamin. You describe your retention strategy in detail. Are you using any engagement surveys to track the effectiveness of the retention strategy? I mean, obviously you want the ultimate effect to be more retention, but in the interim, are there any surveys or anything that you're doing?
Yeah, so we use the Prescani engagement survey. We just took it and we will be getting the results back in about 2 weeks. I don't actually even have them to share with you, or I would transparently tell you what they were. I'm nervous that they won't be as good as they have been historically because nurses were very stressed over this last year. But we do a Prescani engagement survey every year, and that is for all of our team members, but obviously the nurses get very specific questions, and that's how we track.
Got it. Okay. This is a question from Tim. This is about the topic of, you mentioned the topic of burnout and stress and the way your team is putting in place to help with that. It's particularly, burnout affects leaders, in a slightly different way than say your staff nurses, and your preceptors too. Anything that you've put in place in terms of technology or strategies to support your nursing leaders and your nursing preceptors?
So we're working on the Preceptor right now because that has come up, and I'm sure lots of people are feeling the same thing in their institutions because we have the same nurses precepting multiple people because we have to hire so many nurses. So where in a year they might have precepted a couple of nurses, now they're precepting back-to-back nurses, which is really causing a lot of strain on them. I have not instituted anything to alleviate that yet at the moment, but we have begun talking about that because that's a real thing. So if anybody has an idea about that, I'd be completely open to it. For our nurse leaders, we have given them some very specific training around resilience and wellness. And they all went through, it was like a 4-hour course around it. That was one thing. We are actually, and I'm not promising anything, but we are looking at 4-hour work weeks and other things that might actually work for our leaders to relieve the stress and burnout that they're feeling. We've also looked at our span of control, right? And made sure that we have everything lined up so people have a workable amount of team members that they're responsible for. So we literally just redesigned several things, added some assistant nurse managers, made sure that our directors were moved into areas so that the span of control was more reasonable.
Got it. Okay. This is just a comment. I think this is from one of your former team members at Jefferson, Jim Trainer. He says, "Thank you, AMC, and we miss you."
Oh, thanks, Jim.
Awesome. The question from Brittany, what's your average turnaround time for onboarding a new hire in nursing?
Yeah, it's about 60 days right now. Okay. It takes us 40 to 60 days to onboard someone.
Got it. All right. And then, so I mentioned earlier that the second most common thing that nurses are looking for is a better schedule. What are you doing to address, the desire from talent to have more flexible schedules or different scheduling options?
Yeah, I can't say we've done anything that's like rocket science, but we've done what most people have done. We've created a lot more part-time jobs. We have in our float pool, there's a lot of options where you can work 4, 8, or 12 hours. We have weekend plan options for people. So many nurses now do not want to work full time. That's kind of new in nursing over the last couple of years. So we have hired more nurses, but we have the same number of FTEs. So we have more people working like part-time or per diem and things like that, which is it was a unique challenge in itself because it leads to a little bit of that instability, not anything like we had with the travelers, right? Where they come in for 12 weeks and go and then get a new nurse, but they're not here for 3 days a week. They're not here for 5 days a week. You have multiple people taking care of patients on a team. So it is a new challenge that we're really going to have to figure out how to get that continuity of care for our patients and make sure that we're not missing anything.
Got it. Related question to that, adding more flexible options as well as, everything you just described, adding more part-time roles and so on. For some teams is a very contentious topic with the nursing managers, okay? Because honestly, it introduces more operational complexity, right? How did you overcome, any sort of like resistance from nursing leaders around adding more of these options?
Well, how did you know I had resistance?
I mean, it's inevitable. Every health system does.
Of course we did, especially for people who've been doing this for a long time, right? Managers. And we actually had probably 90% of our nurses were full-time. I had never seen that anywhere before. So really getting them to shift into this concept. And once they saw how many people, when they posted those part-time positions and they had twice as many applicants as they were getting for the full-time, it was easy. I didn't have to do much after that. Okay. I just had to get them to break up the positions and post them like that. And then it sort of like took on a life of its own. But that's really what people are looking for now, that flexibility.
Yep. Okay. We got to meet nurses where they are, right?
Yes.
Great. And then I'm just curious about your relationship with HR, right? The collaboration between nursing leaders and HR leaders and talent acquisition leaders is so critical to driving success here, in whether it's nurse hiring or nurse retention. How were you able to form like a strong relationship with your HR team? That does not exist in all health systems as well.
Yeah. So we do have a wonderful HR team. They're all relatively new in how they design themselves. They recently instituted the business partner model. And so I'm not sure how many hospitals have or do not have that, but we did have it where I worked before, so I was familiar with it. So every leader has a key person that they're tagged to basically in our human resource department. And that person helps them break down barriers where there has to do with like, employee counseling, coaching, discipline, hiring, recruitment, retention. They kind of are the tag team for all things in HR to sort of expedite what we need done, which it's a fabulous model and it's been working well for us. And of course, I have a person, right, that they gave, me as my partner. So, and we, from our level, we set up all the strategies and things we want to work on, and then the teams work on them together.
Okay, fantastic. Annmarie, thank you so much for sharing with us today all your strategies and your tactics for these very tough topics that many of us are trying to tackle. And for everyone who joined, there is a recording, and a member of our team will be sharing the recording with you after the call. We will definitely connect Wendy and Annmarie. This is the questions, so you can jam about the lift team. And just thank you everyone for joining, and our team will be in touch, and feel free to get in touch with us at any time. And appreciate your time, Annmarie.
Oh, thank you. Thank you for having me. Have a good day, everyone.
Thank you. See you.
Bye.
Bye.